This is Boston College School of Social Work's Racism-Based Violence, Injury, and Prevention Lab. This video discusses one of our publications, titled Physical and Mental Health Outcomes of Black Emerging Adults with Community Violence Exposure, an integrative review, co-authored by Dr. Danielle Walker, Dr. Casey Bills, and Dr. Robert Modley. The study was published in the Trauma, Violence, and Abuse Journal. Community violence exposure is defined as exposure, either as a victim, direct witness, or learning about the event from others, to intentional acts of interpersonal violence committed in public areas by individuals who are not intimately related. Community violence exposure can be understood as a public health crisis in the United States as it can impact the mental and physical health of individuals, especially vulnerable communities. This study explored the impact of community violence exposure on the health of Black emerging adults ages 18 to 29 in the United States. An integrative review of 19 published studies was conducted to study the associations between community violence exposure and physical and mental health outcomes among Black emerging adults. For adverse mental health outcomes, the studies found that depression, psychological distress, PTSD, anxiety, and suicidal ideation were associated with community violence exposure. In terms of physical health outcomes, studies found community violence exposure was associated with an increased risk for cardiovascular disease, particularly for Black women. Additionally, community violence exposure was found to predict hypertension and type 2 diabetes for Black emerging adults. Finally, parental and friend support was found to buffer the adverse effects of community violence exposure on health outcomes among Black emerging adults, underscoring the strengths within Black communities that help mitigate these impacts. These findings show that community violence has real consequences for both mental and physical health, especially during a critical stage of development. They also reinforce that community violence is a public health issue, and that addressing it requires culturally responsive mental health resources and supports that truly meet the needs of those most impacted. Other implications for future research, practice, and policy are discussed. In conclusion, this study shows that community violence is not just something people experience, it's something that shapes health, stress, and daily life in lasting ways. But just as important, it also highlights the strength and resilience within these communities. Moving forward, the goal isn't just to understand the problem, it's to support solutions that reflect people's real experiences and build on the support systems that are already there. If you're interested in learning more about this research, click the link in our caption or scan the upcoming QR code.